So hi everyone, thank you for coming, really, thank you. I'm Jody, and I do body work called acupressure, which is Eastern medicine. So what I wanted to talk about just a little bit is what in the heck that is, and then also compare it to what some other of these like body work words that we've heard of. We all heard of like the words like massage or chiropractic, and now things are getting really popular that are, I call them the gadgets, like the PEMF band or the Beamer blankets or anything like electronic or something like that. So I was going to tell you what acupressure is so it can be explained in a way that we can all understand it, because it's not new, but it's newer to us kind of over here on the western side of the world, and then go through some of those common modalities of body work that we've all heard of and be like, okay, so what is what and which is which, and if I'm going to get body work for my horse, how do I pick what I want to do for my horse, and how do I pick what I want to pay for my horse? And I will say at the end of the day, your horse is always right. So even if it's me working on your horse and your horse is like, I just don't like Jody for some reason, that's not going to work, we're not going to be a team, then fine, then I'm not the answer either. So the horse, in my opinion, has to be very much an active participant in the body work. So they have to enjoy it and benefit from it very much so, because it's all about them. So yeah, so welcome. So I'm Jody, and I started out with horses my entire life. My grandparents had a dairy farm in Nebraska, and my mother and her sisters grew up riding horses that way, and that just trickled down. So I started out riding horses at a really young age, and then just kind of graduated a little bit up and up into fixing small little problems for horses, and then starting my own horses and all of that. And I officially quit starting horses for other people, I think it was like 3 or 4 years ago, just because I didn't have the time anymore. I love it, so I bought myself another horse and I did that. So so that's what happened. But I got licensed for large animal acupressure in 2016. And the reason I got into it is because I was doing a bunch of colt starting, and all of these young, happy, healthy horses, right? They should be perfect. They're like, you know, high school kids playing on a basketball team, like nothing's wrong with them. You know, they can eat 3 cheeseburgers for lunch and they're still fine and all that stuff. So I would ride these horses and start these horses, and you know how you ride a horse and it's not exactly always the same right to left. So figuring out how could I make the right side just as good as the left side. Like maybe you're, you know, loping on the left and it's fine. You go to lope on the right and then you drop the shoulder in a lot. Like how? Okay, I know that part of that is training and figuring out and all of that, but shouldn't it be the same on both sides, you know, at the end of the day? So yes, it should. That's the answer, it should. Even us. So we're not 100% symmetrical on both sides, but we should feel the same on both sides. You know, this side shouldn't generally feel tighter than this side. So I found acupressure, and that kind of solved the problem. So it solved the problem to having the same horse on both sides. And then I found that it could solve many other things. So then I started reaching out, and I was like, okay, well this horse, and other than, you know, not being the same on both sides, this horse is more like, hey, I have a sore shoulder. Okay, we can work on that. But instead of just putting a Band-Aid on the shoulder, for example, we can get it at the source. So that's where acupressure comes in. Eastern medicine, Chinese medicine, works off the pressure point system. Does everybody know we have pressure points? Okay. Horses have the same pressure points we do. Dogs and cats do. Everything does. There's 361 pressure points on the body. All the pressure points correlate back to an organ system within the body. So in Eastern medicine, what this means is, so my horse has a sore shoulder. Okay, I can work on pressure points on the shoulder, no problem. But in Eastern medicine, the organ systems, the spleen and the stomach, govern or control muscles in general. So I can work on that shoulder, and then I can actually go back to the organ system within, and pressure points to that might be somewhere on the back leg that I'm actually using to support muscles in general and the shoulder specifically. And think of it, if your horse has a cut on their shoulder or something, you don't want to actually physically touch that and work on that, so you can get it at the source, so to speak. You can always get something to something from somewhere else in the body. Everything is very connected. We say very interdigitated, and it's like a little domino effect. So you fix one thing, a couple of things get fixed, kind of like that. So acupressure, Eastern medicine, all of that. Another way of explaining it is think about something that we eat that we are allergic to. So you eat something, you ingest something, and then you might have a physical reaction outwardly. Your face might break out, your neck might break out, you might get red because you ate something that you were allergic to. So that's an example of something happening inside the body that's manifesting outside the body. So just like with horses, if I have a sore shoulder, I might really just have a sore shoulder. So that's manifesting outside the body. So I can help that superficially on the shoulder, sure. But let's get it from within the body at the source, at that organ level, and that Eastern medicine side of things, and go ahead and help it in that way. So that's acupressure in a nutshell, basically. And if I still have you, then that's, I always kind of like tread a little lightly on the Eastern medicine side of things because I really, really geek out on it and I love it. But every organ system has a set of pressure points that correlate with it. So there's something that controls your muscles. There's something that controls your anxiety. There's something that controls bones and bone marrow. So there's pressure points in organ systems that help and support and regulate all of those systems. So my horse that is 25 years old that has arthritis, and I was just saying, like, it's okay to age. We just want to age gracefully without pain. So I can work on, the joints specifically around that and get that lubricated and fluid and moving. But what I want to do is grab it at the source. So I would go back and work on kidney and bladder organ systems because those govern bones and bone marrow. So that's how everything in Eastern medicine is kind of connected, so to speak. And we will have, time for questions, of course, but also just throw something at me. We're a small group. So that's acupressure. So that's acupressure Eastern medicine. So what the difference is between that and some other kind of modalities on the bodywork side of things are, let's see, I said massage. So massage is a common word. We probably all have heard of a massage. Massage will literally kind of manipulate the long, lean muscles, and you use 20 to 25 pounds of pressure to do that. So if anyone's ever had a massage, you like it when someone actually gets in there and works on a muscle. We like that level of pressure because we are a predatory animal. So horses are an animal of prey. So that's why I like the lighter touch. Doesn't mean that horses don't like massage. It means they may love it, they may not love it, but they may like acupressure, they may not like acupressure. So find out what your horse likes, basically. Chiropractic is actually called musculoskeletal manipulation, or MSM, and that is popping a big joint back into place, basically. And in the state of Texas, you do need to be a licensed human chiropractor or a licensed large animal vet to do chiropractic work on horses. So just to know that. The reason for that is because you can hurt them that way. So you want that person to be a doctor doing that because it is invasive, as we say. Whereas, just as a comparison, so chiropractic is invasive. Acupuncture, they say, is invasive also because you are literally puncturing the skin with a needle. So that also, in Texas anyway, has to be done by a licensed veterinarian. It's considered surgery because it pierces the skin with a needle. So just for those things. And with acupuncture, with the needles, I've had this done for my horse for a sarcoid on her cheek that was not open or anything like that, and it worked to have that go away, which was awesome. But I've also seen acupuncture done with horses where, you walk in, you put a bunch of needles in, you walk away for 15 minutes, you come back and take the needles out. Cool. Okay. But what I like about the acupressure, which is what I do, is you can adjust as you need to because you're using your hands and you're feeling the energy and you're feeling things move. And so often I'll have a horse that's sore or off or whatever in a certain area, and by the time I've actually gotten around to work on that area of the horse, it's fixed because everything is so connected, interdigitated, all of that. It's a little domino effect. Oh, this got helped and then that got helped and then that got helped. That's interesting. So that's why I like that. The PEMF bands and the Beamer blankets and all of that, I call them like the gadgety stuff, anything that you plug in, all of that pulls circulation to the area. So I'm not against these things for sure. If your horse likes it, great. That's the difference. If your horse doesn't like it, if it's too much pressure or too much anything, or your horse just doesn't like it, then it's not going to work. But all of these pull circulation to the area that you're using it on. So the PEMF bands, it looks like that hose thing, and you can move it and drape it over certain parts of the horse. You can also do that with your hand. You can do it with a water hose. You can do it with a little piece of duct tape. You can do it all kinds of ways. So I always just say, watch where you're spending your money and just know what you're doing, what you're buying. Doesn't mean that's bad for the horse. It just means, there's options out there, and you guys should be able to know your options. In addition to that, always ask your body workers about their background, their schooling, just like you'd ask your vet, or if you know your vet is the guru of kissing spine surgery, then awesome. But if you don't know this vet, they're a new vet, or you're new to the area or whatever, hey, where did you go to school? What's this? Like people that have put themselves through a lot of education are very happy to share with you what they've done. So I saw on Facebook, it just kept popping up on my phone, like, get licensed for trigger point therapy in 4 hours. And I'm like, what is this? So I looked at it and said, yeah, sure enough, there's a course 4 hours long online. You can get licensed for trigger point therapy for horses. And all trigger point therapy is in a nutshell, not like belittling it, but just to say what it is kind of quickly. It's, say I have a tight muscle, you find the tight muscle, and you basically put a little bit of pressure, not past the point of resistance, hoping that works out. And then maybe that starts to feel a little softer if I hold my fingers there, and then you can push a little bit deeper, and then maybe that works out. Great, awesome. Well, now we all know how to do that, and that was 30 seconds. So I don't like when somebody has gone on and taken a course for 4 hours online and then tries to charge you $100 an hour to work on their horse. That's what I don't like about it. So always ask about their education and all of that, because that will help us all be educated as a horse owner. And it doesn't mean that trigger point therapy isn't right for your horse at that time. Just know what you're buying. So for acupressure, for example, it was over 300 hours worth of school and then continuing education, and now I even teach it for a school. So that would be like a 2-year program in school to do. So it's pretty extensive, and then the test is somebody watched me take a test in a room for, well, it's a 6-hour, it took me 30 minutes, but it's a 6-hour test. I was such a nerd, like I said. But you need to be put in that pressure cooker. If I'm gonna have you work on my horse, I wanna make sure that you were in that pressure cooker and you have that education and you sailed through that test and you had no problems, and wow, yeah, that's who I want working on my horse. Not somebody who took a course for 4 hours online and doesn't know anything else about horses, and now you're trying to charge me $100 an hour to work on your horse. That's just not my favorite. That being said, doesn't mean the therapy is bad or anything like that. Just know your body worker, just like you would ask your farrier. Where did you go to school? Where did you learn this? How long have you been doing this? Is this your main job? Do you have 6 other jobs? Just as you would ask anyone. So be picky about who touches your horse in general, who feeds them every day, who body works them, who trains them, who does their feet, who does their vet care, who does their teeth. Like all these things you get to ask questions and be picky about as the horse owner. And I think a lot of us horse owners forget that, or we haven't done that. I certainly haven't done that. So I'm trying to make sure that I'm saying consciously, ask questions, because that's super helpful. So we talked about all the gadgety, gimmicky stuff, which sounds like I'm against it. I'm not really against it. Yes, of course.
Among gadgety type things?
Yes.
Magna Wave.
Yes.
Is a very big thing.
It is.
It's just another one of the gadgety things. I mean, every horse show I've been to, there are Magna Wave practitioners going around.
And it's not.
The horses.
Yeah, it's not necessarily bad for the horse by any means. If the horse is standing there loving it and enjoying that session, then great, awesome. I'm just not sure that as a horse owner, I'm not sure how much I would pay for that to be done to my horse. Is all. And like the PEMF bands, I know that machine is expensive, and I know that test to do that is a 16-hour course on your own home computer at home and studying all that. So doesn't mean you studied pathology, doesn't mean you studied anatomy. It's about how to use the machine. So it just depends on, did you go to school for anatomy and pathology and types and temperaments of horses, and do you know the first, they gave us a book and it's like this big and it's like the first 5,000 things that are gonna kill your horse, and I'm like, yep. So all that stuff. So just ask the questions, you know, say why, who are you and why do you have this machine? How did you get to do that? You know, that's cool. And if your horse likes it, great. And if my horse is at a horse show and she's sore and she's going to enjoy this, sure, why not? But just so that it gives you a little bit more power as the horse owner to know what you're buying. Because if us in general as body workers aren't doing a good job of conveying, you know, that, because I try to tell all my clients now, I'm like, hey, do you know what I had to do to get this license? Like, that was a lot of work. And, you know, and it's a proctored test. It's a 6-hour or 7-hour test that I took mine at ACC. And, you know, you put all your stuff in a locker and you go sit down and somebody watches you take a test at a computer. And it's very intimidating, and it's supposed to be. But it's awesome. I love it. I love this job. Yes?
Where do you get certified for?
There's Elemental Acupressure is the school that I work for now. I got certified through a school called Tallgrass Animal Acupressure, and they had retired from being a licensing school. 90% of this is online, of the schooling, and then 10% of it, I would say, is hands-on. So you do all of your schooling and all of that online, and you have support with the school and everything, and then you have to do, I forget, I think it's 7 or 8 days of actual hands-on training with my boss and I, or my boss and my counterpart in Arizona. So there are options, but
You don't have to necessarily relocate to somewhere that has a school to get.
no. You would have to locate to wherever we're hosting it for that week. So like I went to Colorado actually for my hands-on because that's where it was located. So, but that was a week. So yeah, the rest of it I was at home having my day job, doing all the things. So, and it's very rewarding to be able to work on horses and to make them feel good. It's awesome. It feels great, you know, if you can help them. And they are our best friends and our babysitters and our therapists, and they take on so much for us, and it's nice to be able to give back to them. So I'm certainly not against necessarily any one modality or the other. Like I've had other people, I've had a chiropractor work on my horse, I've had an acupuncture on my horse. It just depends on the situation and who it is. So my horse was going to get a chiropractic adjustment. I had actually sent her to a trainer, and he said, hey, this horse needs XYZ. And I said, okay, great. And he was like, oh, I didn't think you'd be okay with that. And I'm like, no, I'm just picky about who works on my horses, but I know you're picky about who works on your horses, so that's why I'm okay with it. Otherwise, you know, yeah. So that's all. Just like I'm picky about their vet care and their feet care and their teeth care and what they eat every day and, you know, all the things. And who house sits at my house when I leave and who watches my horses. Like you have to be picky about all these things because we advocate for them. And especially at, you know, a rescue event where unfortunately so many horses have come in from situations that are not stellar situations, you know, and one of my heart horse is a Bluebonnet horse. And so I just feel this, like, no, you will be protected and you will be loved, and I will just bulldoze anybody else who does otherwise to you. So, you know, but I think we forget to advocate for them a little bit sometimes because people in positions, you know, of medical authority or whatever can be scary, and that's very valid and true. But ask questions. It's okay to ask questions. You're allowed to ask questions. So I hope that is what you take away from this for sure. Yeah.
Sorry.
No.
What about it kind of it's not really a gadget, but a different modality, I guess would be the word. What about like Reiki, energy work?
Yeah.
Is that something that you see as kind of a separate item?
From?
I guess like pressure points. It's not really pressure points so much as sometimes they're not even touching the horse.
Right. So we call it no pressure acupressure. Yeah. So where the energy is a very real thing, and anyone who's had 2 mares living in the same pasture 100 yards apart, you know, knows that energy and like one little ear flick is a thing, very real. But yeah, so energy work is huge. You know, you've probably had the situation before where say you walk into a room where there's a couple and they've just been fighting, but they shut up, so you didn't hear anything, but like, you know, it's just tense in there. So energy is very real, and that's what Reiki is and all of that. So they are working on that and channeling energy. Energy work is super real for horses, especially because they're an animal of prey. So they are super sensitive. They can feel a fly almost landing on their back before it does. You know, they, like I said, a whole herd, you can watch a whole herd just suddenly change, like all together like that. Like, how does that happen? If we all tried to run out this door together, we'd run into each other. You know, horses could run out and escape a mountain lion, and I'd be dead, but I'm not running. But, you know, like, they're just so much more sensitive than we are, which is also why I chose acupressure for getting my license. But they really are super sensitive to things because they're an animal of prey. So we are a predatory animal, and whether we eat meat or not, we are a predatory animal. So we tend to like the pressure of a massage or an acupuncture needle. We like that level of pressure. Horses, you know, don't need that much pressure, don't always like that much pressure. And as you ride your horses and everything, obviously, we like to get to a point where, you know, it looks like the cowboy that's like sitting up there doing nothing, reading a newspaper, and his horse is doing all these cool things. You know, it's not that he's not working, it's that he's refined it so that it takes such little pressure that he can have this horse do all these amazing things, and that's how he's communicating with it. So you always go back to little pressure when you do that stuff. But not to say that I haven't ever massaged my horse, you know, when she likes it. So it's all relative to what your horse likes. And I get it, it's hard. There's so many things now these days, right? Like, there's so many options. So it's like, well, what's good, what's not good? I would start by asking, what does my horse like? What does my horse need? And do I have a practitioner around me that is open to having these kinds of conversations? Because anyone who's like, no, it's my way. You know, any trainer says that too. Like, no, I don't need lessons, I know it all. No, just run away, for sure. But yeah, they're really good with no pressure, little pressure, and that is why I like this so much. It's effective because the pressure points are in the right spot. I don't know if you guys have ever heard this, but if you pinch right here in this like fatty little triangle, if you have a headache, that's what you do for a headache. So that's large intestine 4. And it's the master point for the face and mouth. So if you have a headache and if you don't know where the pressure point is exactly, just pinch a little too hard and you'll be like, okay, found it. But I don't know all the pressure points on the human, but this one's a good one for headaches, and you can see how effective it is when you actually start using it on yourself a little bit. So that's one of the cool things. So whatever works for your horse is the right answer. Somebody who will be nice about working with you and talk to you and have time for you, if you know, that's also a good answer. Yeah. So yeah.
Sorry, I have a lot of questions.
That's okay. Give me questions.
Do you find that acupressure, so you train in public?
Yeah. Yes.
Do you find that acupressure was kind of like a game changer in your training?
Yes.
And how so?
So kind of like I said at the beginning, where you have like all these happy, healthy baby horses, you know, 2, 3-year-olds. I start a lot of quarter horses, so we start them at 2 and 3. They should be perfect, right? Nothing's wrong with them. No one's touched them yet. And they're just not the same right to left. So how do I strengthen something on the right side? How do I strengthen the entire right side of a horse? Or even work on their mind? So with babies especially, you want babies making good decisions. You don't want your baby horse that you're sitting on top of. Now you're on top of a 1,000-pound flight animal, and you really want it to make a good choice. You're like, please make a good decision. Don't run over there. Don't do that. So in acupressure, Eastern medicine, small intestine, large intestine. So in the body, we eat food, goes to our stomach, goes to our large intestine, small intestine. The intestine's job physically is to absorb the nutrient that, I promise I have an answer to this, we're going to absorb the nutrient that we're going to absorb, and we're going to excrete the nutrient or whatever that we're not going to keep. So the intestines basically line up, this is a good idea, this is a bad idea. So by working on large and small intestine meridian systems on the pressure points on the horses, I'm helping the gut, yes, but I'm also helping the brain go, this is black and this is white, instead of this is like light gray and dark gray. So you're actually being able to help your horse make better choices because they can see their choices more clearly. So it's actually the liver that makes the choice. So it's like if I have a salad and a piece of cake, you know, I can see that. There's not part of a piece of cake with a salad, not part of the other, but I can line up my choices clearly. So if the intestines are clear and pressure points and the mind is clear, well, that's fantastic. I'd rather ride that horse because they're going to at least have options of good choices, black and white, versus both gray areas. And then you're like, well, are we going to fall off this way? Or are we going to fall off this way? I don't know. But Now, it doesn't mean that the cake is always the bad answer. Sometimes the cake is the right answer, but at least you have black and white choices lined up, and then you can make a decision from there. So that's one of the biggest things I love about how it affected training, which was let's be calm in the mind, anti-anxiety, and have good choices, which is something I love when I'm sitting on a baby horse, because it's scary. We can get hurt. Humans are fragile. Yes, ma'am.
Just on the answer, just let you know I have 1 minute.
Oh, I have 4 minutes. Okay,
Sorry.
questions?
If you want to add something.
So, sorry. So you talked about the meridian, and I know that's a term they use in Masterson as well.
Yes.
So are the meridians in acupressure the same as the ones that the Masterson folks
Yes.
use? And I know she said Reiki. I mean, is that similar to Master? Yeah, I have some familiarity with Master.
The Reiki is energy work, so you wouldn't actually be touching the horse. And meridian system, so every organ system has a meridian. So there's the bladder meridian, which is what they use a lot in Masterson method, and that's what they talk about. I don't believe they use any of the other meridians, but every organ system, so like the heart has a meridian, the small intestine has a meridian, the liver has a meridian, and a meridian is an energetic channel. So if you want to think about, I have a meridian from here to here, which I do, which you do too, that is an energetic channel, and there's pressure points along that meridian. So if you have to think of a meridian as like a nerve or something like that, you can, but it's not. It's not a nerve. It's just purely energetic. You can't dissect it. And so that's what Masterson method does, use the bladder meridian. I don't believe they use the other meridians when they're talking about doing anything. We use 12 meridians that correlate along with the organ systems, and then 2 extraordinary vessels. So like I said, same horse, right to left. So 12 meridian systems with all of your organ systems, you know, lungs, heart, pericardium, stomach, spleen, liver, gallbladder. Horses don't actually have a physical gallbladder, but they still have the meridian system of a gallbladder. And then, you know, kidneys, all that stuff. And then the horses have, we call it the governing vessel, which runs the dorsal midline. Because horses are the same, we're all the same, right? Like right to left, but horses are not the same top to bottom. So you have the dorsal midline on top where the spine goes, and then the ventral midline on the bottom. And those also have their own pressure points on them.